If you've given your dog Bravecto, NexGard, or any of the common flea and tick medications and you're now worried about possible side effects, this episode is for you. Last week, we spoke with Dr. Judy Morgan about reported side effects from popular flea and tick medications commonly prescribed by veterinarians, and we've discussed the FDA warning regarding certain isoxazoline flea and tick products. And for many pet parents, that conversation sparked a new question. Many are now thinking, okay, I already gave my dog Bravecto, what should I do now? And today is about that next step. This is not about panic, it's not about guilt, it's about understanding how to proactively support your dog after flea and tick medication, even if they seem completely fine right now. Because sometimes symptoms don't show up right away. I'm your host, Charlie Pruden, and this is the Next Level Pet Parent Podcast, where we help pet parents support long-term health naturally with practical, science-informed conversations that actually help you feel empowered. In this episode, I'm joined by Julianne Lee. Julie has spent over 2 decades in holistic veterinary care and homeopathy. She has owned and practiced in some of North America's longest-standing holistic veterinary clinics, taught at the College of Animal Homeopathic Medicine, and lectured for leading veterinary homeopathic associations. She's the founder of Adored Beast and has helped thousands of pet parents understand how to support the body after flea and tick medications. In today's conversation, you'll learn why proactive support after flea and tick medication matters, even if your dog hasn't shown obvious side effects, and you'll learn the practical steps you can take right now to proactively support your dog. As always, this episode is for informational purposes and not a substitute for veterinary advice. Let's dive in. Julie, I'm so grateful that you are here. Welcome back to the podcast. I know this conversation is going to bring a lot of peace of mind to our listeners today. So thank you so much for taking the time.
Thank you for having me. It's always nice to see you. You look so bright. And is it warm wherever you are? Where are you? I never know where you guys are. It's like, oh, we're not there. We're in Thailand. Oh, no, we're not there. We're here. It's like, where are you now?
We're in Cape Town, South Africa.
Oh, right. So that's why it looks so nice and warm. I'm still like a heating pad. I'm sitting on a heating pad because it's so cold and it's right here because of the snow.
Yeah, we just managed to just get out of New York before the snow. So the big snowstorm came. But yeah, I'm super excited. We have been talking about creating this podcast episode for a long time. Before we even start talking about preventing side effects or supporting the body, I want to just talk a little bit about your experience and the way that you have helped pet parents overcome the prevention of side effects from medications like Bravecto or Seresto, because these flea and tick medications are incredibly common and so many pet parents have used them with very good intentions because they've been given those medications by their vet, keeping up with their flea and tick treatments. So I know that in your practice, you've talked to a lot of pet parents all the time who are suddenly questioning a decision they made out of love. And when someone comes to you feeling scared or guilty about the side effects of these flea and tick medications, what is the first thing that you usually say to help them take a breath and calm down?
Probably the same thing that I still do say is that no one does anything to their animals for intentional harm, so everybody's doing it because they feel like they're protecting their pets, either from being chronically itchy from fleas or getting Lyme disease or some kind of tick-borne illness. So it really is. I think maybe it's more my energy because, when I had my clinics, it was even vaccines and even food, right? Because I've been doing this for a long time. Having to detox from flea and tick medications, predominantly flea, I was really alerted with it probably in 1999. I started seeing side effects because people would come in to see me with chronic disease or issues. We'd get them on track. They'd go and they would do their Flea, back then, their Flea treatments, and bang, they're right back into their chronic disease process again. So it was pretty clear to me quite soon that these particular drugs or pesticides, not even drugs, and insecticides were causing massive harm. I was trying to, dig in more. Andrea Ring was my vet tech and my manager. She's a journalist. She really looked into stuff, and we started telling people, really cautioning people to not use them and to use alternatives. But I think it was 2005 or no, 2006, somewhere around there, that at my clinic, I actually got a fax. So it was that far back from the Vet Association with a warning that pregnant women are not supposed to be touching their pets once they use that. And it was like, okay, well, I wonder how many people are actually I wonder how many vet clinics are actually telling people this or paying attention to this. So I blew it up and framed it and put it in my waiting room for people to start to be like, okay, if it's so inert and it only goes to the subcutaneous fat layer and it's not systemic, then why are we worried about this? So quite early on, I had to figure out protocols. I had to figure out ways of sort of rebalancing the body when people were using that.
Before we talk about the actual protocol, because I know that's going to be very detailed, I just want to talk a little bit about the why, because I think what happens a lot with pet parents is that they've been giving something like Bravecto, for example, for a very long time, and their dog has always been fine. Why do you think that a pet parent who has given a flea and tick medication and their pet seems to be okay, why do you think it's still important to proactively support the body afterwards, even if they seem fine?
Because they seem fine. That little seem is the key word. And we know that dogs and cats aren't living as long as they used to, right? We know that chronic disease and cancer is on the rise. So just because they seem fine because they haven't had your typical seizure or because that's a big one, right? Having seizures, vomiting, diarrhea. We don't know. Animals can't talk. Is there a subtle change in their energy? Are they just not quite as bouncy? Are they just not quite as limber? We don't know until the accumulative effect of year after year after year or month after month after month finally hits. And by the time it hits, nobody thinks it's the flea and tick medication because they didn't have an immediate reaction, or all of a sudden their liver values go up, or all of a sudden their kidney values are up, or all of a sudden they get pancreatitis, right? It's this deep level of creating harm, deep level of becoming toxic. Some of them really affect the nervous system, so they may not have full-blown seizures, but are they all of a sudden starting to get anxious? They may not have full-blown seizures, but are they starting to get aggressive or cognitive disorder where they're just put it down to, oh, they're getting old, right? They're getting older, geriatric cognitive disorder. We don't know. So all I can say to I think 100% address that is that you can't give an insecticide or pesticide without it causing harm. It's virtually impossible, especially month after month or year after year. It is going to cause harm.
Thank you so much for explaining that. Something that I'm just reflecting on right now as well is that when we were talking to Dr. Judy Morgan about this topic last week, she was also talking about how so many of the adverse reactions are actually happening not just within the couple of days after
No.
these medications are given. They're sometimes happening months after. So I think that's also a good idea of why detoxing from these medications or supporting the body after having given these medications becomes also very important, because we just don't know if our pet's going to show adverse reactions in a couple of weeks,
Or months.
and or months, yeah, and also a lot of times when these adverse reactions show up, we might have already forgotten we gave that medication a couple of months ago. So I think, yeah.
Well, that's a really key point, because that's the same with, vaccines. It's the same with drugs. It's the same with anything. It's like, if there's not a fairly immediate reaction, then drug companies or, veterinarians aren't trained, it's not like they're, intentionally going, oh, it couldn't be that. They're not trained.
Mm-hmm.
They're not trained to say, oh, a vaccine reaction could happen 6 months down the road, right? Then they're like, oh no, it wouldn't be the vaccine. They're not taught that by the drug companies in school. Exactly the same with flea and tick medication, right? So people, take your dog to the vets, and all of a sudden it's like, yeah, like now every time he eats chicken, he's throwing up, or every time this is happening, or he's, getting off of his food, or he's seeming slower to get up. I can tell you, not very many veterinarians are going to say, when was the last time you gave him a flea and tick treatment?
Mm-hmm.
That is even going to be on their radar. Not because
Yeah.
they know what they're doing. It's literally not on their radar. It's not something that they're educated to ask. I'll just say fast, like, because you can just compare it to this. I went to a meeting to be sort of against a dump, right? Like a landfill in our area. And I went to this meeting, and they kept saying all these studies. And I said, but I kept saying, what's the accumulative study? When you do this, and when you do this, and when you do this, and when you do this, what does that equal? And they literally stopped letting me ask questions, because they couldn't answer my question, because they didn't know. And it's the same with veterinary medicine, right? We don't know the accumulative effects of everything we're doing. And we're looking at one drug at a time. We're not looking at flea and tick medication, skin atopica, vaccinations, like the list goes on and on and on. Antibiotics, antacids, no one's looking at, like, it's going up the escalator, right? More and more and more.
Yeah, absolutely. So before we go any further, I want to just pause for a second, because we've been mentioning the word detox for quite a few moments. And I know this word can feel a little bit intimidating or even off-putting nowadays.
Yeah.
So when you use that word in practice, what does detox actually mean in simple everyday terms for pet parents?
It can mean all kinds of different things. From my perspective, the word detox, you're 100% right. Like, I don't support the old school detox where you actually get worse before you get better. You're purging, the animal's purging. I've never done that in practice. It's always been super gentle and like sort of a slow rebalancing perspective with any diseases, actually. And I think the way of looking at this is, first of all, I wanted to say is that there's lots of flea and tick medications out there, and each one of them has different side effects. The flea and tick medication that you go and buy at a pet store like Zodiac is equally as horrific, if maybe not more so in some ways, to some of the older ones that vets used to prescribe, because now it's got not just flea, but flea and tick. We're ramping it up, and some is like parasites, fleas, ticks. Like we're like dropping bombs now. So the way I always look at this is every animal is an individual. So with Mika, let's say, that medication might affect something completely different with her than a German Shepherd or a crossbreed or another animal that has a different kind of already pathology, or an animal that's already on different kinds of drugs. When I say detox, what that means is, from a high level perspective, looking at what is actually happening in the body that we need to support. So we want to look at the nervous system. We want to look at the portal system, liver, pancreas, kidneys, the detoxification process in the body. Not necessarily we want to do this massive detox on your animal, but how is this affecting the detoxification process, or overwhelming the detoxification process in your animal's body? We want to look at, cognition. We want to look at so many different, the gut, right? Like it just plays havoc on the microbiome. So, it's not just antibiotics that mess up the microbiome. It's definitely flea and tick medication. And then what happens is it messes up the microbiome, and then the microbiome's not super, flexing its muscles when it comes to if you get bit by a tick. So if your animal gets bit by a tick and it's receiving these flea and tick medications and messing with the microbiome, it doesn't matter what they're on. They're going to be more susceptible to that virus, that bacteria, that protozoa, they're going to not be as prepared as they could be. Right. So it's detoxification for me is looking at every single solitary system of the body, everything, and addressing it, because I don't have a crystal ball. I don't know how that medication is going to affect each and every single solitary animal. So instead, my main purpose of detoxification is to go in with particular, nutraceuticals, homeopathy, the list goes on and on, herbs, probiotics, and try and give the body as much support as it can to do its intelligence, which will then be to know how to detox whatever system is being affected.
Thank you so much for explaining that in such a great way, because I do think that the word detox can be a little bit overwhelming sometimes. So that makes a lot of sense, what you just mentioned. And by the way, the new flea and tick drugs, like you just said, now it's not just about the fleas, it's also about the ticks, but the new ones are actually also heartworm in there as well. So it's a lot for the body. And then, like you mentioned earlier, also on top of that, a lot of dogs are getting it at the same time as yearly vaccinations. So before we go into your protocols on how to help our pets through that, I know a lot of pet parents or listeners that are listening right now are probably thinking, if someone gave a flea and tick medication days, weeks, or even months ago, does active support right now still matter? Like, is it too late for them to start these protocols that you're about to mention?
No, even if it's been years, it doesn't.
Okay.
Right. Again, it's the same with vaccines. It never is too late, because the body, often I used to say, just bring the body back into homeostasis. But when I did that, people didn't really understand what I was saying or what I was meaning. So, using the word detoxification or using rebalancing or whatever, for me, it's the same thing. For a lot of companies or people or veterinary clinics or whatever, holistic practitioners, detoxing is a lot stronger, So I'm not advocating that, that's for sure. But I don't advocate that with anything. So at least not, and no, I don't advocate for that. So the main way to look at this is that, we know with vaccines, with homeopathy, it's called vaccinosis, right? You can have long-term side effects from a vaccine, their first vaccine. It can still affect them. it's the same with everything. Like I said, they don't have the ability to talk to us. So if that was a child and a 7-year-old even, they could say, oh, my, every time I da 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 da, this hurts. You might not notice it. They may not be crying, right? They may not be throwing up, but there's a shift. And that shift could be communicated. Those shifts can't be communicated with an animal unless you are like a massive helicopter mom and I tend to be, and lots of people are, and that's why I always say, even when you're going to do a protocol to try to rebalance them, keeping journals are so important. Like, I just can't even stress how important it is, because these subtle signs are going to be saying, oh, there's something off, or, oh, wow, they're getting better. I can't believe I never noticed they weren't jumping on their favorite chair. I didn't notice that they were, not doing this, and now they're doing that again. Oh, I wonder how long that's been since they've been doing that. Like, that's how animals communicate to us. That's how we know whether they're getting better, whether they're maintaining, whether they're slipping back. So to answer your question, it's never too late.
Amazing. Awesome. Thank you for clarifying that. If you're listening and you're feeling overwhelmed, trying to figure out what's actually safe and effective when it comes to flea and tick protection for your dog, you're truly not alone. There's a lot of conflicting advice, and most pet parents just want clear, responsible guidance. That's exactly why we created our ultimate flea and tick protection guide. Inside, you'll find trusted expert insights on natural prevention, treatment options, and even science-based resources that break down potential side effects of common flea and tick treatments. It's all designed to help you think critically and make informed decisions for your dog. You can download it for free in the description below. And this episode is actually part of our flea and tick awareness series, where we're building this understanding step by step. If this episode has been helpful to you so far, make sure you subscribe to the podcast so you don't miss the next conversation on this topic. So the next question will be, how do we support our pets after giving flea and tick medications? And of course, in a best case scenario, we wouldn't be giving flea and tick medication at all, and we will use natural alternatives to help prevent fleas and ticks, and also natural treatment for fleas and ticks. But if there is a pet parent who's, maybe just learned about potential side effects of flea and tick medication, what can they do right now? What are the protocols that you have been using in your veterinary clinic and over the past decade to help pet parents navigate this topic?
We all wish we could live in a perfect world. We all wish that we had the time, the energy, the money, the everything, that we could do everything perfect for our families, right? Which my family are 4-leggers. So, but it doesn't always happen. Circumstances happen where, you need to, it's the absolute only daycare on the planet that you can take your dog to, and they absolutely won't allow the dog in unless they have some kind of flea and tick on board, right? So that's the other thing. It's like, sometimes there's circumstances that happen that people just don't know what to do, and you've got to speak to this with children too, from a perspective of people love their children and still have to vaccinate their children, even if they don't want to go to school, right? So, do they not love their kids? So it's I think it's there are going to be circumstances where people may have to do it in at no fault of them, but big fault of governmental overseeing, right? Or insurance companies, or the list goes on and on. So I try really hard to look at every approach, like everything, from a perspective of, I don't live in that person's house, that person's body, that person's situation in their life. And if everybody is, this isn't like a pass to go out and use that stuff, because that is not what I'm saying. But I'm saying that sometimes circumstances happen and people are too embarrassed and feel ashamed that they have to go out and do something that they don't want to do. Right. So I think that how I've also looked at it is that everyone needs to do their own. If you have a few minutes to just pay attention to what you have to do. So let's say a circumstance comes up and you have to do this. Then what I always say to people, do your own, you know your dog, you know your breed, you know its age, you know its past history. I mean, unless it's a brand new pup, unless it's a rescue dog. In general, you can sort of sense their breed. And so I always find it very empowering to look at all the data of all of them, right? All the different kinds of flea and tick medications. So not just one. Then you can actually see, okay, this one really affects this system. This one's more neurological. This one, you know, the main thing we're concerned about is seizures. This one, the main thing. And then look at your breed, right? What is it more susceptible to? What is it? So that you can also kind of narrow down the risks of each situation even more. And it gives you way more information, right? It just empowers you more as a pet parent. If you can choose not to do the whole bomb, right? Like, don't do, like, if they say, oh, you just have to have flea medication, like, try finding it. It's really even hard to find it, that it's just flea and not flea and tick. Don't just jump out and purchase, if you have to do it, the first one that your veterinarian is recommending. Take a minute and actually look at them and decide for yourself which one you think is the less invasive. You know, is it a pesticide? Is it a drug? Is it an insecticide? You know, insecticides they stay in the water system, they stay in the body system for longer. If you have to do it, then get prepared. So let's just say, if you have to do it, let's start with that. If you have to do it, get prepared. Try to make sure that your dog or cat is as healthy as it possibly can be prior to. If it's got any kind of issue at hand that you're getting a drug for or you're taking medication for, try and space it out. Try to wait. Like, if you're on something and you know you're going to be weaned off of it. So if I know that my animal is on some kind of immune suppressive drug for a skin issue, and it's time for this flea and tick thing, and I have to do it, and wait, right? Like, say, wait and see when's your weaning off point. And once it's weaned off, then potentially, you know, do everything in your power not to, but if you can't, try and space things out, right? Try to space them out with drugs, or even stresses, you know, stress levels and stuff like that. Stress levels in doing drugs or flea and tick medication is also a mix, not very helpful at all. So basically what I'm saying is, if you are strong armed into having to do it, you have no other options, don't wait till you do it and then try to rebalance the body. Get it prepared. You know, really try and prepare ahead of time, making sure that you're supporting the dog's or cat's liver, make sure that it's eating whole foods, make sure that the microbiome is really, like, make sure that you're using a variety of different kinds of probiotics and rotating them so that the intelligence of the gut builds, especially the understanding of how the gut actually detoxes things, right? Because it does, including chemicals. Yeah, just be prepared. Don't just be strong-armed, do it, and then wait for the negative symptoms to happen.
Absolutely. Yeah. Thank you so much for explaining that. And, you know, I think, unfortunately, like, you're very correct in mentioning that some people are just very forced into doing these treatments with their pets, and there isn't much that they can do, unfortunately, because of daycares or, you know, things like that. So something I'll just mention, just sliding into this conversation, is that some clinics will allow you to take home this flea and tick medication because it has to be given with food.
Yeah.
And if that's the case, then you'll just do what you need to do at home, right? Wink. Of course, it's always important to, whatever you do have a natural alternative. Don't just do nothing to help prevent fleas and ticks or kill fleas and ticks, right? So let's start talking about the actual natural protocols that you recommend pet parents start implementing after they have given flea and tick treatments. And that doesn't matter if, that was because they didn't know 1 week ago and they gave it, and now they're looking for, what am I doing? What can I do to help prevent side effects? Or maybe this is for someone listening who just doesn't have another choice and has to continue giving it in the future. So let's start talking about the protocols that you've developed.
So let's start with knowing that there's been an issue because of flea and tick. So someone's done it. They know that they've been struggling with a situation with their animals since then, or their animals have been, did have a seizure or did have something dramatic where you can absolutely link them together. We always would start off with homeopathy because it's so fast, right? It's not like it's, a probiotic where it has to build up in the system, or an herb where it has to build up in the system. It's immediate, it's instantaneous. So the remedies that we always looked at, if there's a sudden negative consequence, we would give arnica and aconite. And the reason that we did that is because it's literally an insult and shock to the system, right? So it's not just the chemical that's trashing the liver or the nervous system or whatever. The body literally goes into a type of shock. So aconite is amazing for shock. Arnica is really good for anything that's traumatized, including physiology. So trauma to a kidney cell, trauma to a liver cell, trauma to the nervous system. Because along with, let's just call it, being poisoned, or along with some kind of massive chemical reaction, comes damage. And arnica is really good for anything that's traumatized. And then we move to a remedy called nux vomica and phosphorus. And they're two different remedies, and they both have different mechanisms of action. So phosphorus is incredibly helpful for the blood system and really, really helpful for the kidneys and the liver, the pancreas. So it's really helps to support chemical reactions in the body that are negative. Nux is literally given in poisoning. So chemical poisoning as well. It's a different mode of action to phosphorus, and it's more for the nervous system. It's more for, well, they're both for GI. They just complement each other so well when it comes to chemical poisonings from things like flea and tick medication and supporting the entire body. So we would do that in fairly high potencies right away. Actually, we would do something called a bell curve, or a combination of different potencies. So we would do a crude potency of maybe 12C, like a lower potency to hit it on the more physiological level. And then we would do, 200C, 1Ms, sometimes even 10Ms, depending on how severe the case was, quite frequently to try and derail that, really intense reaction. So, if you have an animal that is, is in a situation right now where it is really being affected negatively, you should reach out to a homeopathic practitioner, a homeopathic veterinarian, and see if they can they can do that protocol for your animal, because you would need, if it's that bad, you'd be under the care of a veterinarian. So that's if it's really intense right away. So if something's happened and you've given it and you aren't really seeing too much of a side effect, then, or you're just more concerned about side effects, it's kind of everything, right? It's like, again, like I said, you don't have a crystal ball that you can look inside your dog's body or your cat's body. We don't know what its predisposition is. We don't know, what is your particular pet going to be susceptible to as it ages. We don't know any of that. So for me, it's more of a very holistic approach. So you want to rebuild the microbiome. And in order to do that, it's so interesting, because in order to rebuild the microbiome, you are also to not get tick-borne illnesses, to be able to be stronger, to not be a host for parasites like fleas or worms or anything like that. So rebuilding the microbiome, and for me, the best way to do it is rotating probiotics, right? So don't just give one probiotic that has the whole kitchen sink in it day after day after day after day, because the gut is intelligent. It needs to learn. If you read the same book day after day after day after day, you would remember that book, but you wouldn't become resilient to other things that you needed to learn. The gut needs to maintain its resiliency, which means you need to plant certain seeds that will, bring that intelligence into that body for specific viruses, for specific pathogenic bacteria, for the gut-brain axis, for anxiety, for cortisol levels, the whole 9 yards. Then you put another bunch of strains in for something different, and then you do a different one. So you sort of like do one. I can just speak to our product. So I would do, one Phytophthora, finish Phytophthora, go on to Soil and Sea. Completely different probiotic, completely different strain, completely different isolated bacterias to help for different things. And then you could go on our wolf one, right? So it's like, and then you just go back. So it's not difficult. You just run out of one jar and go into another jar. So I would be doing that for sure to rebuild the microbiome. Make sure that you're using probably fulvic and humic acid at some point. If you do have problems with skin disease, right? So some type of skin disease, you could be looking at healing the gut lining, right? Because chances are this medication has decreased the integrity of the mucosal lining of the gut. And then you're going to go down the road, my dog has allergies. No, your dog doesn't have allergies. The flea and tick medication has probably started to destroy the mucosal lining, weaken the junctions, and now you've got leaky gut and you've got sensitivity activities. So it never hurts to go through a protocol to to support leaky gut syndrome, then rotate probiotics. That's a given for me, and it was at my vet clinic as well. You can do, if you've ever given the medications, you can always do, a single dose of 30C Nux Vomica, a single dose of phosphorus 30C. You can do that just as a very gentle detoxification that you won't even notice. You just do one single dose and leave it at that. And then work on the microbiome, and then liver, right? Like liver, pancreas, kidneys, all the systems that will have definitely had some kind of added toxicity, added, inflammatory response because of this. So milk thistle and berberis and, chelidony, like all the different types of herbs that support that entire system is really, really important as well. And diet, right? Fresh food, so that you have peroxide dismutase, phytoplankton, all the things that you would think that will help the oxidative stress, which is the thing that happens to the body that causes long-term chronic illness, cancer, the whole 9 yards. So again, you can't point your finger on what is this drug, pesticide, insecticide going to do with my dog or my cat. So what you do is you look at everything. You're just creating a healthier being, a healthier body. There's nothing negative to it. But absolutely, those systems, the nervous system, so amino acids, which also phytoplankton has tons of, antioxidants, liver, kidney, pancreas support, and the gut microbiome and homeopathy, for sure. If you do have to go and get it, then definitely probably 30C, 200C, aconite, arnica, nux vomica, and phosphorus prior to giving it. And then do all 4 of them for twice a day for at least 3 to 4 days after you've given it, just to try and help derail it, along with everything else that I just said.
Amazing. Thank you so much for going so detailed into this question. You know, something that I love just in general about this approach, it is a mindset shift, because we're shifting from thinking about like giving one drug, or let's say talking about flea and tick medications, if we had given that to our pet and now we want to prevent it, a lot of pet parents might think, oh, I can just give one single thing to help prevent side effects, but it's not like that. Once your pet has these medications administered to them, it's not like we can just give an antidote or something, right? So
No.
we want to like really holistically, from many different angles, help support our pet's health overall through all the different things you mentioned. Like liver support is really important, and then gut health. I actually thought it was very interesting that you mentioned gut health before you mentioned liver health, because I would have thought you would have gone straight into liver health. But it sometimes we forget how important gut health really is and how much it affects the rest of the body, before going into detail.
Well, what happens is that if it's affected the microbiota, then chances are the mucosal lining has been affected. Let's pretend we haven't even given a flea or tick medication. Let's just pretend for a minute. And the body's gut health is just not optimal. What winds up happening is the mucosal lining becomes inflamed, right? And then the junctions stretch. And then toxins, even forget about flea and tick medication, any kind of toxins, along with food particles, slip into the bloodstream. Guess what happens then? The liver becomes more detoxified. You're contributing to creating your liver to be, or your animal's liver to be more toxic if you don't really look at gut health right away. I'm not saying do one first and do the other one. I'm saying you've got to look at both of them, because without looking at both of them, you're kind of paying attention to the entire body. And if you can support the liver from now till whenever, if these things are seeping through the mucosal lining and going into the bloodstream, you're actually creating toxicity for the liver. So how is it ever going to catch up? How's it ever going to heal if you're not paying attention to that as well?
Absolutely. You mentioned nervous system support a little bit. A lot of pet parents are especially worried about neurological side effects after flea and tick treatments because of, you know, what is. There's actually also an FDA warning on neurological side effect from drugs as well. So when we're thinking about proactive support for the nervous system in particular to help prevent neurological side effects, is there anything else? You mentioned phytoplankton. What about supplements like MCT oil, or is there anything else that you would also recommend?
First of all, when you're dealing with anything, you want something as clean as possible, right? You don't want to be adding fuel to a fire. So if you're using, MCT oil, if you're using any of that, like that's why with our potency, I really like potency for brain health and neurological stuff. And the reason is because I'm not worried about heavy metals from the ocean, right? Contributing even in small amount, or microplastics. You need to do due diligence on, if you're looking at the nervous system, you really need to look clean, like clean as much as possible. Where was the milk thistle planted? Did they, it's just, the nervous system is it's everywhere. It's in everything. But what you need to remember is that it's a cell. Even the nervous system has cells. So brain cells are everywhere. So when I am doing my cancer research at Dalhousie, that's what we're looking at. We're looking at cells in general, chronic disease in cells, cancer cells, what happens to cells, like cells, because it's everywhere. It's in everything. Things that decrease oxidative stress is going to help with cytokines and inflammatory responses. And that's what you want to hone in on with the nervous system, is decreasing inflammation, supporting the cell in general. We have our vital defense, which is chaga and phytoplankton. And those two combinations, along with spirulina, what that does is it doesn't really matter what cell is affected. It helps to support the derailing of oxidative stress, which is what happens when you have a negative chemical reaction, pollution, the list goes on and on. So it just falls into that category. So for neurological stuff, if you're really concerned, the gut also controls neurology, right? Conductor of kind of the entire body. So following that whole protocol for neurological, support, along with, like I said, like potency, right? For brain health and neurological health. And amino acids are really important, and decreasing oxidative stress is very important for anything neurological. And when you use Nux vomica, it is very, very good for, like, it's one of the first things that we see. If we're using Nux vomica, when we were using Nux vomica in cases of, animals having twitches after, animals having ataxic, like they're dizzy, they're falling over because of a chemical reaction. Nux, you can see the difference with Nux really, really quickly. Therefore, it has a very strong affinity in that system of the body. So if people are worried, then they definitely should do the homeopathic protocol along with all of this other stuff.
So you just mentioned potency, actually, and on the Adored Beast website, you have a statement that says rosemary extract, which is one of the ingredients of potency. Rosemary extract can be contraindicated with epilepsy. So how do we go about using potency in this scenario with the possible neurological effects of the flea and tick treatments?
So it's being used instead of like synthetic or chemical preservatives, right? That's why it's in there. So we have to put that claim in because of the FDA and Health Canada. So we do our due diligence all the time with that. It's like weighing out the odds. So if your dog is in full-blown seizures because of that, then I wouldn't do that. I would be doing, if they're in full-blown seizures, you have to be very careful of what you're using. That's why homeopathy is so amazing, because it's not contraindicated in anything. So you can go in with those remedies with full-blown seizures. It'd be supportive no matter what they're giving, even drug-wise. If your vet's giving any kind of drugs, you don't have to worry about anything being contraindicated, like herbs or a nutraceutical when you're using homeopathy. It's brilliant that way. So, but when we're thinking about that is if they have epilepsy, right? If they already have epilepsy. So, not, and if that's the case, if your dog has epilepsy because of that, we're in a whole different game of,
because of the flea and tick treatments, you mean?
Yeah. Yes. then we're in a completely different game of, like I said, working with someone like Andrea Ring, or working with somebody
Yeah.
that has incredible experience with homeopathy and things like epilepsy. Vital defense, though, again, for oxidative stress is pretty amazing, right? To decrease the inflammatory response from oxidative stress and slow that loop down, right? That sort of chronic loop. You know, we have to be, it's so funny, it's so interesting where we have to put claims. When it comes to herbs, and it comes to like natural whole foods, and it comes to nutraceuticals, and it comes to anything like that, we are scrutinized 1,000 times more than drug companies. Veterinarians can recommend off-label, meaning like a drug that's not even been researched, and they are allowed to use it because of some kind of, empirical study, or someone's tried it and they're like, okay, yeah, go ahead and use it. Whereas, things like homeopathy and herbs and food have had empirical proof for centuries, if not thousands of years. And we're not allowed to use certain claims, or we have to put crazy warnings on things. So, yeah, I mean, that's it brings me back to Zodiac. We know that Zodiac has been the demise of I don't know how many cats, and yet they're still allowed to sell it in pet stores. I always find it fascinating, the relationship of treatment and prevention. I mean, right, with my cancer research at Dow, it's not just cancer. How can I find a way of helping animals with cancer? I had to do an added study around that about prevention. So when we think about how do we detox from these horrible drugs, it literally is very similar to how do we protect our animals from getting a tick-borne illness. It's kind of
true.
It's one and the same. It's like if we can just skip the drugs and teach people how to maintain a healthy body, we wouldn't even be having these conversations. We'd be skipping that, right?
So true.
It's crazy because that I struggled with Lyme, right? I had Lyme disease, and so I've done so much research into what is it really about? What is tick-borne illness really about? Because I didn't do drugs, right? And I was really, really sick, like debilitated sick. And the more I researched, the more I understood the importance of the immune system with any of these illnesses, and what decreases your immune system. What decreases your immune system is using drugs like this and not paying attention to or using drugs in general, any drugs, any kind of chemicals, not eating healthy, not getting enough exercise, stressed. If we could just shift our ways of looking at health rather than the magic pill, the quick fix. Because usually the magic pill and the quick fix, down the road, everyone's going, oh my God, why was I convinced to do that? How come, why would a drug company allow this? Why would any veterinarian get behind this? Because people want quick fixes. And 90% of the time it doesn't work unless it's hit by car, right? Where you need emergency surgery, then thank God for quick fixes, But in general, overall health, chronic disease, tick-borne illnesses, cancers, there isn't quick fixes. It's a day by day.
It's kind of like a marathon.
Yeah, and being aware, right? Just being present and being aware of what you're putting in
and consistency.
Yeah. And if you slip, don't freak out. Don't beat yourself up. Just get back on track. Because what happens a lot of times is people slip with their animals, they feel guilty, they feel ashamed, and then they just kind of go down this rabbit hole. It's just the same with people. You're staying on
Yeah.
a really clean diet for a week, you go away and you're not on this clean diet, right? And then you come back and it's like, well, you just stay in that shaming yourself. Oh my gosh, I can't believe I ate all that. I can't believe I drank all that. I can't believe, so you just keep doing it. It's just about, we're human, we slip up, and then you just get back on track without all guilt.
I think sometimes it can feel like some of our listeners might be feeling like this is a lot right now. I can't do everything all at once. And I think it's very important to remember that, the holistic approach is, more complicated than just giving one thing. You do have to look at different angles, and it will include more modalities than just one conventional drug. But at the same time, I think it's also very important to remember just to start with one thing at a time.
Yeah.
Once that becomes a habit, look at what's the next thing that I can start with. We don't want to overwhelm anyone.
No.
I think the fact that everyone's listening right now, it means so much for your animal, and it means that your animal is going to benefit from all the information that you've learned today, and just really take it one step at a time and be consistent with it. I think that's the most important. Would you add anything to that, Julie?
Yeah, I would. I feel like I think it sounds complicated now because we're digging in to like the philosophy and the physiology and what can happen and all of that. It seems overwhelming. Healthy living, right? It's not, you don't have to be a holistic specialist in any way, shape, or form. If you think of good food, good gut health, supporting the liver, we all know what antioxidants are, right? Antioxidants is a pretty basic word. Fruits and vegetables. I'm starting to really dig in that dogs need a lot more fiber and a lot more vegetables than we've been giving them. And that's a topic for another time. But
Yeah.
but antioxidants are something that should be in your fridge all the time. To pollution, it's our savior to stress. It's our savior to lots of things, is eating things that decrease oxidative stress. Rotating probiotics, right? Don't stay on the same probiotic, or don't go on a probiotic that has supposedly everything in one, because then you're giving everything in one all the time. So rotation. It's the same with, you don't want to eat everything. Would you eat the same food every single day? It's why we talk about dog food, giving a bag of dog food, the same dog food every single solitary day, even though it's balanced. You want to rotate things. You want to shake things up and move things around. So rotating probiotics, fresh food, right? Fresh food that has antioxidants, a liver support. When you think of that, there's three things. And stress, decreasing stress, exercise, and love. I can't even begin. It's free. It shouldn't be easy. It's something that benefits your animal and yourself. Really, it isn't. It's not that complicated. If you break it down into those 4 categories, it's actually not that complicated. It becomes complicated if you're in a situation where they've already had a negative effect, right? It becomes a little more complicated. You want to pay a bit more attention to it. But prevention and trying to detox is, I would be happy to get something written up for you guys, of just the protocol that you can share on your site, send out to your listeners, that really breaks it down more simply so that people aren't overwhelmed.
Yeah, that's amazing. I'm actually working on a flea and tick ultimate kind of prevention and treatment. And also the next topic we're talking about is tick-borne diseases as well. So I'm actually working on like a master file. So
Yeah.
If you send that over to me, that protocol, I will definitely include it in there and
Okay,
also
great.
put your credentials on there. And for everyone listening, I'm going to link this PDF in the show notes so you can download it there for free. Amazing. Well, thank you so much, Julie, for this
Welcome.
amazing episode. Once again, it's just so incredible. We always learn new things when we talk to you. And I'm excited to launch this episode and help pet parents navigate this prevention part of it, and hopefully help lots and lots of pets not have adverse reactions to these drugs.
Yeah, just bring their bodies back to balance.
And keep them healthier as well. So
yeah, it's like a win-win, really. You're welcome.
Exactly. All right, let's take a quick breath together. If this episode brought up a lot for you, I want you to hear this clearly. You're not a bad pet parent for trying to protect your dog. We always make decisions for our dogs with the best intentions, and sometimes we only learn the bigger picture after the fact. What I hope this conversation helped you understand is that if you have already given Bravecto, NexGard Simparica, or any flea and tick medication, you are not powerless. You can support your dog in a calm, proactive way, even if they seem totally fine right now. And instead of looking for one magic antidote, the most helpful mindset shift is to think in systems, supporting the gut, supporting the liver, supporting the nervous system, and building resilience over time. And please remember, this is not all or nothing. You do not need to do everything today. Pick one small step from this episode and start there. Consistency beats intensity every single time. And if you want a simple next step to follow, download our free guide, The Complete Flea and Tick Protection Guide. It's linked in the description below for you. And we made this to take the overwhelm out of this and give you a clear path forward. If this episode was helpful to you, I would love for you to share it with one fellow pet parent who's been feeling unsure or worried after flea and tick medication. That one share can genuinely help someone breathe again. And before you go, make sure you subscribe, because in the next episode, we're continuing this conversation with a deeper look at natural flea and tick protection strategies. Thank you so much for listening, and I'll see you in the next episode.